National Guard only going to Butler? I know you've expressed concerns about kind of using some of the same staff that would be called up, but why only Butler when other states like Massachusetts have kind of had a more comprehensive approach if staffing issues are the biggest issue at hospitals right now?
Yeah, I'll let the general answer that, but as I mentioned in my comments, that we're continuing the conversations of how the National Guard can play a role in the current situation. But General.
Yes, sir. Thanks. Thanks, Governor. Good morning, everyone, and great question, Brian. Thank you. And one of the specific points in the way that we are sort of working deliberately in the difference between the Massachusetts approach and ours is one of getting very specific as to what the need is. And the need that was brought forward through Care New England was this capacity to enhance the wraparound services at Butler. Essentially, as a layperson, my explanation is our support to Butler through transportation, through patient observation, through tasks that have required, just based on staffing, high-end medical care, providers. We will be able to manage many of those tasks for them that do not require that level of education and professionalism, and that will enable them to focus, on patients while we're handling support. That sort of exponentially allows them to open up more beds, and that's how we see it coming together.
Hi there. It seems that with the Omicron variant, that most high-end mask that you may have right now, a KN95 or an N95, is the best to prevent transmission or infection. Are there any plans from the state to additionally hand out masks, these higher-end masks, to folks as well, on top of the rapid testing and the vaccination efforts that we have right now, too?
Did you say change the high-end mask, or is that something about the policy?
Plans to hand out those masks.
Handing out masks has been done throughout this entire time. Our message continues to be access the high-quality masks that you're able to access. We've been working with our communities, health equity zones, community-based organizations, municipalities throughout the state to deliver masks and make them available while also knowing they are available for people to be able to access. So we are taking every approach possible to make masks a norm in what we need to face right now.
Can the general or someone please clarify exactly what will be happening at Butler? This is for Butler patients, is that correct? Not for bringing in other people? I spoke recently to Dr. Finale. He said that 2 units there had been closed. Will this allow those units to be reopened? And so, long way of saying this is for patients at Butler, is that correct?
So the direct answer is you need to confirm that, please, with Dr. Finale. That is where I would, turn you to specifically. They become patients of Butler Hospital, once they get there. In theory, the way that our planning cycle is working right now, and how we are sort of being educated and inculcated with the staff there, is that there could be a patient from some other hospital or provider setting that is in a stable enough, again, I'm a layperson, but in a medical condition that allows them to be transported to Butler to get the behavioral health services they require, thus freeing up that external provider, freeing up the space in the ER, the emergency department, freeing up a hospital bed, and moving that patient to where they need to be on a more expeditious, safe, again, medically cleared, but from my perspective as the person that needs to get that job done, get them to Butler in a safe manner.
So these are psychiatric patients, not non-psychiatric?
That is correct.
Governor, as I recall, the indoor mask mandate was going to be reevaluated in a month. Are you thinking that it's going to be extended beyond the initial 1 month?
Yeah, so I anticipate that would be true up against the stop date that right now the General Assembly's put in place on 180 days. So we'll be communicating to the the leadership about how we're going to work our way through the, you know, that time frame that the 180-day ends at, which is, I think, February 14th. So we intend to put, you know, continue the orders that are in place, which are important for us through at least that date and beyond, hopefully.
Governor, why, sorry, I'm trying to see around you there. Why only 100,000 tests? Massachusetts is ordering 26 million. You had talked about getting 1 million out in January. 100,000, that would give a test to only about 10% of Rhode Islanders. We need millions, do we not?
Well, I'll let Mark handle that one, or Tom, but I can tell you that, again, 175,000 tests last week. Twice the amount of tests of the second, you know, the second state in that order, and multiple times more than Massachusetts. So, and also remember that Massachusetts got 7 times the population that Rhode Island has too, right? So you have to kind of like certainly downsize that. But I'll let Mark kind of give you the idea of where we are in testing and the fact that we'll have what we need in Rhode Island, and we'll continue to lead the country as we have. And I think it's been remarkable, quite frankly, that the data shows that we're testing at twice the amount of the second state in the country, and multiple times more than Massachusetts. But Mark, you want to just answer the question about, or Tom? Tom, either way.
All right, good afternoon. So just to separate kind of 2 pieces of this, so, you know, the announcement out of Massachusetts yesterday, I don't know the details of their procurement strategy, but that's kind of in the vein of what that is, the long-term purchases over the next few months, of which, similarly, you know, we have millions on order. So why 100,000 this week? Because that's what we know that we have. I think we've seen other states locally. I know our own experience is that manufacturers, distributors have not been able to keep up with demand. So over the last 2 weeks, we've had to exponentially increase the number of manufacturers and products that we're working with. So we're confident we're going to meet that 1 million tests this month goal, but we want to make sure that we can deliver on it, you know, when we have those tests in hand. So we have some additional shipments that should be coming in the next few days. There'll be some more detail to follow there. But for some additional context, you know, as the governor shared, 175,000 tests at our state sites last week. We had about 15,000 no-shows. So if you can't make your appointment, please cancel. So it could have been 190,000. But then we also distribute about 140,000 tests each week to our schools, to our employer-based testing programs, first responders, and that's been something that's been ongoing, you know, for well over a year. So we are distributing, you know, millions of tests, and we'll continue to distribute millions of tests over the next few months. Mark?
Yeah, just to expound a little bit on that, you know, I like to beta test a little bit how we get these things out to the cities and towns. Katie, truthfully, we've done this before with them, with different parts of COVID, with PPE, masks, and shields, and different PPE items. So I think the 100,000 is a good number to get out to the cities and towns, just so I don't want to overburden them with taking in product right away, and then I want to make sure that they understand what's coming in and give them time to digest how they're going to send that out to their constituents in each city and town. As Tom said, and the governor and Dr. Nicole, hey, this is not new territory for us. I lived this for 3 years, procuring N95, surgical masks, shields. I remember when we were down surgical gowns to like single digits, and people were sewing them together. So it's just happening again with test kits. So we've got a lot on order. We've ordered a lot more. We ordered more this morning. We anticipate the 100,000 to grow more in the coming days and weeks. And I could be up here next week telling you that a lot more than the 100,000 are going out. But I just feel confident, like Tom said, that we can say that the 100,000 is going out.
General Callahan, I have a question for you, if you don't mind. We're hearing a lot from doctors regarding the staffing crisis in hospitals. For the 180 members already in Rhode Island hospitals, what are they seeing on a ground level?
Yeah, so great question. So the 180 folks that we've mobilized for this particular go-around are kind of spread out. As the governor mentioned, we have about 60 that are focused at Butler. At this point, 75 are working a new vaccine effort at the Rhode Island Convention Center, which appointments are available. So please take advantage of that. We've got 25 personnel that are assisting in Central Falls with the walk-in clinic there. Another 5 or so single digits are working with Mark's team and EMA to, again, backstop some of this high-end distribution. So they're kind of working all over. They are not all in the hospitals per se, but for a bit of context, it is, I think, important to note that what we have tried to do with this particular mobilization and with the sort of the thought process that we do not want to hurt one entity in order to plus up another entity. So as an example, we have on the very low single digits our part-time healthcare providers that are in the National Guard are back on for this particular effort because they have a far more sort of a greater calling within their civilian domain, whether they are, you know, a single provider, they're in ERs, wherever they are. So this particular effort has been to ensure that we can bring on National Guard personnel, that we can meet the tasks that we've been able to meet, but that we don't harm the staffing levels of the state police, the sheriffs, the Department of Corrections, the broad majority of our first responders, and our medical personnel. So there is a bit of calculus there. And so that's why we've been, again, I use the word deliberate in sort of our targeting in terms of how we go after and problem frame.
For Tom, I think, how do you close that last mile to get the testing turned around in under 48 hours? And, you know, I know you said you reached out to other testing labs to bring other lab capacity online. How do you get there?
Yeah, so right now we have, we brought on an additional out-of-state lab. We have 3 labs in the state, and we're confident that as the testing volume stabilizes into this week, we'll be down below that 2-day turnaround time. On top of that, though, we know that people are going to continue to contract COVID, staff are going to be out. We're working through some of those issues at our current labs. We're working to bring on an additional out-of-state lab here in Massachusetts. So we're still kind of working on the contracting pieces of that, but we want to make sure that we have adequate capacity there.
If I can follow up, do you feel that you'll be able to handle, I don't know if you have a timeline that coincides with what Dr. Alexander Scott talked about, which is peaking of the virus and maybe starting to see cases come down. Do those lines converge for you?
They do. I would say we're getting there, right? So a couple of ways we've thought about the health of the program. There's how many people we're testing, and you know, we get it loud and clear. It doesn't necessarily matter where we stand with regards to other states. Are we giving Rhode Islanders what they need? So some of the things we're looking for is, you know, can you get an appointment the same day or within 24 hours? What's that turnaround time look like? Are they accessible? And I would say over the last week, we've started to get back to those guidelines. So as of today, this morning, there are a few same-day appointments available at some of our sites, especially our larger ones. There are many appointments available within 24 hours and across all of them within 2 to 3 days. So we're going to continue to expand the availability of tests at large and the PCR turnaround time. And then the big thing is how we continue to manage this going forward.
Governor, this for the governor. Governor, you mentioned a little while ago that we're about a month away from the emergency declaration that undergirds a lot of the executive orders expiring. Are you working on either a new emergency declaration based on Omicron or working with the General Assembly to find a way to prevent the existing one from sunsetting when it will?
Yeah, I think it's all the above, right? We're certainly going to put ourselves in a position to make sure that we're putting health in at the top of the, list. And just like everything else, we've worked with the General Assembly. We're going to certainly work with them and detail what that date means, relative to current executive orders that are in place. relative to masking in schools and other moves that we've made in the executive orders.
So we should expect in some form it to continue beyond that February date?
I would hope so.
Dr. Alexander Scott, there's a lot of confusion right now, of course, amongst people with what to do, how to handle this. So I ask you, just on a personal level, would you go eat in a restaurant? Would you go to a basketball game? Would you attend a concert at a club in Providence? And what's your advice to people right now that are scrambling around trying to figure out how to handle their lives?
Yeah, as we shared last time we were together, it's definitely important to conduct your behaviors that are different from things you may have done prior to the pandemic, particularly right now. We obviously know that we don't have to be as restricted as we were this time last year when there were limitations in terms of business and mobility and that type of thing. We do have tools that allow us to conduct our necessary daily activities that we implore people to use. High quality masks, making sure that you're boosted, getting tested regularly when you're symptomatic or you are exposed to someone, washing your hands regularly, keeping your distance, and limiting your group and exposure. So I would take those guidelines into account in determining how to conduct, my behavior, particularly at this time.
But you personally, you're vax boosted, you've got a fresh N95 mask, access to testing. Would you go to a basketball game this weekend?
For me, I tend to, even though I'm from a crowded city, I tend to enjoy my own personal space. So I would very much enjoyed the sports activities that were available on TV this weekend. It was a good football weekend, but love doing that in the warmth of my own home. And certainly want to make sure that people have what they need to be able to make the decisions for themselves.
The question, though. People right now are very confused whether or not they should feel like they can go and do things if they are protected as described throughout the last 45 minutes. What's your advice to people? Should you be riddled with anxiety if you go to a large venue that's filled with people, or even a small venue, you go sit at a restaurant? Or is that anxiety sort of unnecessary at this point, given the testing, vaccination, boosting, masking recommendations that you provide?
We certainly
still frozen out of unemployment compensation with a proviso that they are aggressively tested.
Repeat that, please, Pat. I didn't quite get it.
Sure. Again, expensive visiting nurses, utilization of COVID-infected medical personnel at state hospitals, an expensive National Guard deployment. Why won't you simply hire fired medical workers, who, by the way, are still frozen out of unemployment compensation, with the proviso that they are aggressively tested?
Yeah, so right now, the protocol is that you need to be vaccinated to work in the healthcare industry. That's what we've got in terms of a regulation, and we're following that right now. So it's fairly easy answer to that question. I would add, though, that there's multiple ways that we're working on to relieve the stress in the hospitals, and I outlined many of those in what we talked, but, you know, it's either getting more staff in, have less hospitalizations, that's why we're talking about the vaccinations, both the doctor as well as the lieutenant governor, everybody up to the microphone, and also get, you know, having getting people out of the hospital as soon as we can. So we're working on strategies, including the preventative details that the doctor spelled out, and right now the protocol is that you need to be vaccinated to work in the healthcare.
So you would prefer that people be outrightly sick with COVID and work with patients than be unvaccinated and possibly even have antibodies from when they were exposed early on in the pandemic?
Well, again, I'm not, you know, I'll let somebody else speak to the, you know, the details on that, but my understanding is that it would have to be a dire emergency to get into that spot. So I would say, again, we're following through on the current protocols in terms of vaccination, and then we're working our way, and I detailed quite extensively in my comments about the partnerships that we're developing with our universities, with the National Guard, with the Department of Health, with our local municipalities, getting emergency, you know, our rescue and our EMTs on board in terms of, you know, being able to cover timeframes. And we'll continue to work on that level, but the executive order is in place in terms of vaccination and health care.
Commissioner Infante Green, what is the strategy for the next few weeks for the schools?
What is the strategy? Yeah. Well, we are hoping. The schools are working very tirelessly, the superintendents, the principals, the teachers, to keep classrooms open for our students, because we know that schools are the safest place for them. So that is our strategy. We're going to continue to mitigate, and provide them the instruction that they need. Nosotros vamos a mantener las escuelas abiertas, dándole la oportunidad para que los niños sigan aprendiendo. Sabemos, con los datos y la información que tenemos, que las escuelas son lugares muy seguros para los niños. Se puede prevenir porque hay muchas cosas que se están haciendo, como las máscaras, tienen los HEPA filters, hay variedades de soluciones que se han impuesto en las clases.